Welcome, everyone.
Hey,
we are back.
We're back.
Rick Sorensen, Greg Camp, is Healthier Ever After, and we are here continuing our chats.
Well, today we're continuing our hormonal journey.
Yeah, we have been for several weeks now talking about hormones. We talked about some male hormones and testosterone, and then we've had like 3 weeks. We've been talking about female hormones and kind of the history of that and things. And I think tonight we're going to talk a little bit about sort of the niche that women hold during childbirth and postpartum periods, and how that can affect your health overall and your weight loss goals and all those kind of things. So we're actually kind of excited about that. We have another guest with us. Before we get started, remember this is for educational and informational purposes only, and any weight loss regimen, medication, exercise program, particularly if you are or have recently been pregnant, it's very important to discuss that with your own medical provider, and we'll go from there.
Yeah.
So tonight we have with us Lindsay Ellsworth. We both know Lindsay. Lindsay's been a nurse for several years. We've worked with her, and she's kind of become passionate about sort of the hormone scene. And we'll maybe talk to her a little bit about how that occurred. I've known Lindsay for quite a while, many years of her whole life. Anyway, so welcome, Lindsay. We're glad to have you here. She is. So like I said, been a nurse for several years, and she has just entered her last year of nurse practitioner school at Brigham Young University. And actually, what I've seen with that, I am like nothing but impressed with that program.
Yeah, I've heard it's phenomenal. Really one of the top tier programs in the country.
Yeah. So tell us a little bit about that, your experience there, and a nurse practitioner, and then we'll talk about how you got this motivation to help women with their pregnancy-related hormone things.
Yeah, thanks for having me. I'm happy to be here. I think I love the BYU program. It's been really great for me, and I'm grateful to be studying there. And I think a big motivation for me to go back to nurse practitioner school, I didn't think it was in the cards until I had older children. But my youngest is 2 right now, and I went back to school when he was about 18 months. And a big reason for that was because of the postpartum pregnant hormonal experience that I had. And I developed a big passion for postpartum mental health and just kind of hormonal health in general for women. So that's a big motivating factor for me to my degree.
So this might be a little personal to just chat about with our, like, it's got to be millions of viewers.
At least,
or 12 or 9.
12. 6 of those are in like my a country that doesn't.
Right. Hey, speaking of that, if you know anybody, send a link and subscribe, and we're going to keep putting this information out. We really enjoy doing it. So Lindsay, at risk of being a little too personal, you talked about kind of this postpartum mental health. I've kind of seen you through this postpartum period. You have 3 kids, right? 3 kids now, and you didn't have an easy road postpartum. People say postpartum depression. I might refer to it as postpartum insanity, or something a little more like that. I mean, it was a big deal for you.
Yeah. You want me to talk about it?
Yeah. Like let us know what. I mean, that's kind of what it sounds like. Kind of motivated you to go back to more school and try and help people because of your experience.
Yeah. So my first, she's almost 8. And I remember, I'm a nurse, so I take care of people with mental health issues and all sorts of issues. And you never think it's going to be you until it is you. But with my first, I just experienced some mild anxiety, but didn't do anything. And my first 2 are about 22 months apart. So I didn't feel like my body had enough time to recover. And after that hormonal drop off, after my second child was born, I experienced some severe postpartum depression. And honestly, I didn't recognize it when it's in yourself. Like I could recognize it in someone else. There's lack of motivation. There's, they're not functioning as normal. And I feel like I'm a pretty functional, depressed person, but inside I was not well. I didn't want to be there, and I couldn't connect as well with my newborn. And that was really difficult. And And I got help during that period. And then with my third, I was gearing up for war with the postpartum depression. I was ready. Like I waited 4 years because I didn't think I was capable of doing it again, and got pregnant on accident, or as a blessing, I guess you could say. I think God knew that I need a little push, because I wasn't going to commit. But so grateful to have my third baby. But I was gearing up for the postpartum depression, and then I had him, and I experienced anxiety like I had never felt before, and panic attacks, and I had never experienced that in my whole life. And I just remember one night in particular that Jordan, my husband, was putting the kids to bed, and I had retreated to my closet because I didn't want to be here. And I just remember sitting in my closet crying, and he comes in after he puts the kids to bed, and he's like, "What's wrong?" And I didn't want to be here. And that was a really, really scary feeling. And I don't think you think it's going to happen to you. Like,
I was just going to say that, like you mentioned, you work with people, you see people in that situation, and the thing, and you don't think that's going to be you. You're like, wow, something has happened to them, or they've had something in their life, and that I can't relate to really, but there you were.
Yeah.
And for people that don't know you, obviously, I mean,
no one else
normal, chill, person that like, you're like, yeah, if you like were to guess and draw out of a hat of 50 people that like you'd probably be number 49 or 50 of someone that would be in that state, because you're just so rational and, I would use the word chill, and just easygoing and logical. And so it just kind of shows that impact of knowing that it doesn't really matter your personality or your demeanor. Like, once you kind of get spiraling, it's one of those things where it's like hormonal and all the other things that are at play here. It's just one of those things that you can't expect it. And as someone that is constantly, obviously, helping people in their time of need as a nurse in the emergency department, now you're in this situation, and it's like, you think that you having seen it a million times, you'd be able to just pull yourself out of it.
Yeah.
But I was sorry, and that was more of a statement than a question. But my question would be, actually listening to you, and I've talked to you a little bit about this, of course, offline, but is about after your second child, about how long would you say, was it days? Was it weeks when you started feeling like something was off?
That's a great question. I don't think I really realized for a while. Like, when I look back on that time, it feels like a blur. And now looking back, I totally recognized, I was depressed. But I think it took me at least a month to 6 weeks to realize that something was wrong. And more so than me actually realizing something was wrong with me was my family, my husband recognizing that something was off.
Yeah.
And I think, again, like, you don't imagine it happening to you, and it's harder to recognize when it's you. And you just, as a woman too, like, you spiral, and you're like, well, I am not feeling how I should postpartum. Like, I'm not loving this as much as I should. Like, I'm not loving being with my baby as much as I should. And I think that's really hard, because it leads to this catastrophic way of thinking of, well, I'm a bad mom, or I'm not doing enough.
So you have like this expectation, like, oh, I'm having a baby, and I should love it, and it should be joyful, and I'm hearing you say, like, just the feelings that this hormone shift has, and you don't feel that expectation isn't met. That seems to compound the feelings of inadequacy or failure or whatever that might be. Is that what I hear you say?
Yeah, 100%. Like, I felt completely inadequate, and you feel horrible for feeling the way you do. Like, I had a husband who has a stable job. I had beautiful, healthy children. Like, I had a normal birth, like, that went well. And I felt honestly stupid and ungrateful for not feeling gratitude and happiness. And, but when you're dealing with a clinical depression, like, it's hard to to see reality.
Yeah.
What on your, it sounds like, to even add to Rick's comment, and it sounds like, even having gone through it once, it sounds like on the third child, it sounds like possibly some of that anxiety was also a compounding effect. You were almost probably so nervous about how you were going to feel afterwards that now you're in this, sure, the postpartum depressive stage, but then also just so anxious about that it sounds like the third one almost compounded from the second one, just from those feelings of worrying about having that happen again.
Yeah, 100%. I was terrified to be depressed again, and we were preparing, and I actually stayed on my antidepressant throughout my pregnancy, because I was nervous about being depressed, and little did I know that I would experience crippling anxiety this time. You can't win.
Yeah.
Yeah. Wow. We appreciate you sharing that. And our hope is that, I mean, we've never been through that specific thing, but that's our hope, is that by you sharing that feeling, it kind of emphasizes what we're talking about. The postpartum period. I've got a little summary here. It says it is the most dramatic hormonal drop in a woman's life. Within in the hours and days after delivery, your estrogen and progesterone just like fall off a cliff. And it's the most rapid and dramatic hormonal shifts possible in human biology.
Yeah.
That's how that's described. And so this is it's not like you are sad. It's a real thing that's driven by the absolute most dramatic shift in hormones that the human body ever experiences. Yeah. And
it's not like most hormonal shifts that happen over a period of time, right? This is rapid.
Yeah. And so, people talk about the baby blues, and a lot of times this is a 2-week thing, 1 or 2 week thing.
Yeah.
But about 15 to 20% of women has hormonal crash, and it contributes to real postpartum depression that is serious but treatable, and really, I think, underdiagnosed and underappreciated.
Yeah.
And so we really appreciate you coming in and just helping people be aware that that's a real thing. And so what do we do about that then? I guess is one of our next questions. So that's going to be maybe your future, is what I'm hearing you say.
Yeah, I would love to help other women with this. And I wish sometimes that I could go hug that girl. I call her a girl just a couple years ago that was crying in the closet. I wish I could go back and give her a big hug and say, it's going to get better. And just to give yourself some grace.
Yeah.
It takes time, but there are lots of things that can help and will help. And I think just being aware of it, and I'm grateful we're having this conversation, because a lot of women just expect to bounce back and be normal. And how come she's happy with her baby, but I'm not? And I think giving yourself a lot of grace through that is really important.
Can I pose then maybe that same question in a different way? If someone is watching this that's just, maybe they're not going through this yet, or maybe they are someone that happens to come across this that is actually kind of in this place right now, and they don't really know what's going on. So that girl that you were, that like, you're like, I should have been aware, maybe I should have known, and I just didn't, because it just didn't come up on the radar. Good support system in place, all the things, and yet here you are having these feelings. What would you advise yourself at that time, if you could go back in time, or someone that's listening now? What would you advise, like the first step? I mean, is it obviously seeking help, but like, how would you advise to go about that?
Yeah, that's a really great question. I think, like you said, if they have a good support system, I think that's one of the most vital things, is having someone who cares about you and who's going to push you to get the help that you need, and ensure that you're getting the help you need. Because when you are depressed, as you guys know, it's hard to get the motivation to get help. Like, you feel like it's hopeless and there's no point in getting help.
It's a vicious cycle.
Yeah, it is. So I think one thing that's really important is having a great support system. And number 2, I think anyone who is pregnant, postpartum, just having things in place, like, I'm going to go on a walk, like things that are going to help your mental health, like whether it's outside or fresh air or a food you like or something else. And I don't know I'm not a huge fan of affirmations, but I just wish that I wish I would have wrote myself a letter that maybe I could have read every single day, being like, this will get better. There is help. Antidepressants were a big help to me, I think, and therapy. I think there's lots of little things, but I think the biggest thing that I would say is make sure you have a support system that, hey, if these things happen to me, or if you notice the XYZ in me after the baby, then like help me get help.
So you're even talking about like, this is part of like making preparations beforehand for when this occurs.
Yeah, 100%. Like if it's a big if, but if I do have another baby, I think my husband is prepared, and my close family members are. With every postpartum period, it's gotten a little bit worse in different ways. So I think just preparing beforehand too is really helpful.
Well, I think what, and something that just came to mind while you're talking about that. I mean, I was just actually thinking back on me and my wife kind of preparing for our kids to come into the world. And with each one, of course, it was so different. And we went and got a crib, and we went and got furniture, and we went and got all the newborn baby stuff. And I think it sounds like what should also be on that checklist is really just like, what's the mom stuff that needs to be taken care of? Like, making sure that, like you said, like you have those things in place already, to where if someone's like, hey, if you start seeing signs of this, or if I start saying things like this, like maybe that needs to be more so a focus on preparing women, like maybe even while they're pregnant, to say, hey, you went and got all this stuff for the baby, but someone's going to be there with the baby 24/7. And we need to make sure that the caretaker of this child is going to be ready to deal with whatever.
Yeah, 100%. I feel like for a lot of women, myself included, it feels selfish to have me time or to have preparations for yourself. But I think it's so, so important. And every baby, I've gotten a little bit more passionate about how important it is to take care of mom as well as baby, because baby, the best thing you can do for baby is to be mentally well and physically well.
Yeah. No, I think that's a huge thing. And so did you initially, I know you know a ton of medical people, so I don't know, did you initially just reach out to your OBGYN, or who did you initially reach out to for medical help?
Yeah, that's a great question. With my first baby, I had a little bit of anxiety, and I remember going to my OBGYN and telling them I was experiencing a little anxiety. And I just remember he wrote me a script and was like, here, fill this. And I wanted more. I wanted someone to have a conversation with me, to tell me that I wasn't crazy, that what I was experiencing was normal. And I ended up not filling that prescription because of, back then I had the stigma of like, oh, well, I don't need antidepressants. I don't need anti medications. That's like a bad thing, right? It looks down upon me if I need those type of medications. But when my second came around, the first person I reached out to was obviously my support system. And then I went to therapy first, actually. And then as far as medical, I went to my OBGYN, but then I found a primary care provider that truly cares about me. So I really feel like my OBGYN, they see this all the time, and not that I didn't love him, I do love him, but I feel like sometimes they just write a prescription because, you have your baby and then you get your 6 weeks checkup, and then you go back in a year, and like they see you in a year, it's not their focus. But I really feel like it was my primary care provider who sat down with me for an entire hour. And there was a lot of tears during that session, but he listened to me, and he focused more on not just the prescription, which I did need. It was part of the plan that I needed. But he also focused on more of like, what else can we be doing to help with this?
Right. Yeah. So it sounds like your kind of end goal in mind is to just basically become that resource eventually for women that are going through this, and have that, not only that good experience, get the anecdotal experience in clinic, and then combine that with obviously your education, which is just an awesome, a lot of people go into medicine, into things that they're interested in because that's what they become passionate about. And it sounds like you just want to be like you said, the OBGYN, they see this, 40 times a day. And a lot of times, because a lot of cases are very mild, it's so easy for them to just write your prescription for an antidepressant and they're on to the next patient. So it sounds like what really helped you is that provider that would actually take a little extra time to sit down and talk with you about it.
Yeah, 100%. It made all the difference. And that's the type of provider I want to be, is the one who will sit with the patient and help them realize that they're not crazy. Because like you said at the beginning, I feel like it is a little bit of postpartum insanity. Like, that's how you feel. You feel crazy for even feeling that way. Like, I look back and I'm like, how could I ever have felt that way? But it happens, and it's real, and it's hard. And for someone to sit down and listen with you and come up with a plan with you, it made all the difference.
That's amazing. Yeah. So, we talk about, I mean, we have our little disclaimer that we talk about, talk to your medical provider, and we really mean that. But this is interesting. So I know the primary care provider you're talking about. Shout out to Tom Jones.
Oh, is it Tom? Okay. I didn't know who it was.
Yeah.
I didn't know.
Yeah. You know Tom.
Yeah.
I know Tom.
Yep.
And big shout out to Tom Jones because, I deal with a lot of providers, and I would put him top of the list of anyone I've ever known as far as understanding and really diving in and knowing his patients and their lives and pathology. And, this is a guy who years ago, middle of the night from the emergency department working there, I could call Tom Jones and say, hey, I've got, Lenora, your patient, your 83-year-old lady in the ER. And he says, oh, well, what's her potassium? I mean, he knows that she always has low potassium, right? And she'll say something. He'll say something like, "When how's his husband? He just had surgery on his." I mean, he knows everything about people, and really took the time to get to know Lindsay. I remember hearing about this, and really, kudos to him. And this isn't to diss on anybody else in the profession, but really, I think that's an important thing, and I really applaud you for Lindsay for kind of wanting to model that and be that provider, because that seems to be one of the biggest steps, is just taking the time to understand and to listen and to validate and to come up with a good plan to come up with that. And anyway, so kudos to him and anyone else who really takes the time to understand your patients.
I think really you could do be a provider for even before that happens and help people maybe prepare for that transition and then also into their transition. I mean, I think sometimes we get in the mode that we're not going to prepare for, for the storm that hasn't happened yet. But once the storm's here, and because, like you said, it was a high percentage, 15 to 20%.
15 to 20%.
That's not a small, in medical terms, that's not a small amount of people affected. And it has a trickle effect, right? These, your kids and your family, and not everyone is as lucky as you, Lindsay, to have this solid support system. Even with all that in place, it was still an absolute struggle for you. So, for someone that doesn't have that great support system, imagine having a provider that can help you with the pre and the post if necessary. I think it's just an underserved area, really.
Yeah, I think that's so true. And just one thing I wanted to add too is I hope all women know that, they are going to experience this huge hormonal shift, and it's okay to not be okay, but it will get better. And also, like, if you're breastfeeding, like, it takes a long time to regulate those hormones. Like, if I breastfed my kids, almost all of them, for a whole year, and then up to 6 months after that, I didn't feel normal, as you could say, but it's a long process. Like, that would be 18 months after you have the baby, you start feeling hormonally regular again.
Yeah, no, man, breastfeeding is great. But you're right. The breastfeeding triggers a sustained release of prolactin, and that not only produces milk, but it also suppresses estrogen. And so you're it's like doing the reverse of hormone therapy.
Yeah.
You're causing yourself to be in a premenopausal artificial state for this extended period of time, 18 months. And again, it's a real thing.
Yeah, it's that's really good. And it's important to know. So as far as how do it's a touchy subject. As far as therapy and all that goes, was there any specific techniques that they were like, hey, like these are the things that are going to kind of help you deal with this? Was there anything like you said, you talking about walking or going outside? Was there anything specific that you found with therapy that was like, hey, these are the things that they kind of instructed me to do that were really helpful?
Yeah, that's a good question. I feel like mostly in therapy was about learning to give myself grace, which I'm really bad at. I'm really hard on myself. Like I'm type A. Thanks, Dad. Um, I I am very driven, and so when I'm not functioning to where I think I should be functioning at, I'm hard on myself. I feel like a failure. I feel like I'm not doing enough. I feel like a bad mom. I feel like a bad wife, all of the things. And so I think a huge part of my therapy journey was helping me have grace on myself. And that included like things like writing letters to myself and um, saying things that if it were my friend, what would I say to my friend? And then saying that same thing to me. Because you would say something to a friend, like you would never say these awful things that I'm saying to myself to a friend, but you do say them to yourself.
Yeah.
What your conversation with yourself in regards to being on antidepressants? So it sounds like you had what I think as a general society, we have this kind of
Like
bad taste in our mouth for
yeah.
like antidepressants and things like that. It sounds like eventually that was something that at least was one tool that kind of helped you get through this. So can you kind of talk about your mindset before and maybe what it is now and what your perception on that is?
Yeah, I think my mindset before was if you're on an antidepressant, there's something wrong with you, which I didn't feel that way about someone else. Like, you know, my siblings have been on antidepressants. I didn't think there was like necessarily, I mean, there are things wrong with them, but not in that way, not for taking antidepressants. But, I didn't think that about other people, but when it
Yeah.
comes to yourself, for some reason, there's this stigma. It's like, oh, well, there's something wrong with me if I have to take an antidepressant.
I failed
Or,
at something. I
yeah,
couldn't
I
do it.
failed something,
Yeah.
or I'm not good enough, right? But I feel like once I found the antidepressant, and that's the thing with antidepressants and meds like that, is you got to find what's right for you. There's a lot of
Yeah.
different options. There's a lot of side effects, and everybody's different. And you've got to find out what works best for you. So once I found one that helped me feel better, my mentality changed. I'm like, why do I feel ashamed for taking a tiny pill if it's going to help me be what I want to be, feel the way that I want to feel about myself? And so now, like, I'm 2 years and almost a half postpartum of my third child, and I still take a 10 milligram Prozac every day. A couple months ago, I was like, oh, I don't think I need this anymore. I'll go off of it. And you know what? I didn't feel as good on it. So I'm like, you know what? I'm going to go back to my 10 milligram Prozac every day. And there's absolutely nothing wrong with that. And I think it's a great tool.
That's awesome. I really think about this in terms of when I'm talking to patients about it, because I don't push it. I just want people to have the tools they need to feel good. And it's interesting as patients and really as providers is it's if someone's potassium is low, we recommend potassium. If someone's magnesium's low, we give them magnesium. If someone has any other abnormality that we can see on a lab sheet, we recommend replacing that and
treating
correcting
it.
that.
Right.
And then when it comes to the
time.
mental health stuff, because we don't have a lab value in front of us that necessarily says, hey, your dopamine or your serotonin levels are off, or once again, in your hormones.
We can measure your anxiety level,
Sure.
or your depression.
Yeah.
Like it's not a number that we have.
I just feel like you're accounting for something that your body currently is not, maybe long-term or maybe short-term is not there. It's not in enough of an abundance for you to be able to function properly. So I don't view it any different than it's a tool to be able to correct an abnormality within the body, just like we would once again, correct your electrolytes if they were off. And so I really feel like having that conversations with patients, because most patients, including yourself, I think all of us, it's okay for patients. We understand the benefits. We've seen all the studies, but for ourselves, we're just so hard on ourselves and just unwilling to accept that we would maybe need a little bit of help.
Yeah.
Okay.
I think
Awesome. So you mentioned you got your type A personality from, but you mentioned you got that from your dad?
Yeah, maybe.
Oh, yeah. Okay. Well, spoiler alert, everyone. That's me. I'm Lindsay's dad. We're so glad to have her here with us today. When I say I've known her for many years of her life, it's been all of the years.
Every one of them.
Every single one. No, we're really grateful to have you here, and honestly, are so grateful for your not only experience and personalizing that experience, but for your expertise. I mean, we've seen you kind of delve into this and really come up with solutions that can be shared and helped, and we look forward to you being able to do that for women all over the place.
Yeah. I think having that personalized side of medicine is like really where like good medicine meets good providers, and it's just the two interwoven is really what a lot of patients, especially nowadays, are looking for.
Yeah.
No one's wanting that 3-minute visit in a clinic not to be heard or just to be thrown on a antidepressant. Like, I think if you just get an explanation and someone can talk to you about, hey, this is why we're going to do this. I think it sounds like what Dr. Jones did. And rather than just giving you the medication, there's actually some thought and discussion behind it. And I think I think it's awesome. As hard as it has been to go through this experience, I think it's going to be awesome how many patients you're able to help by being able to relate to that, and then being able to really like take the time with them and dive into this with them.
Yeah, obviously I wouldn't choose to go through what I did again. Like, it was horrendous.
Yeah.
But I am honestly so grateful that I can relate to other people and have empathy for family and for friends and for future patients in this area.
Yeah.
I'm grateful.
Awesome. Yeah. Well, we appreciate you being here. We're going to have Lindsay back for another episode.
Yeah.
Talk a little bit more about the specific weight loss during and after pregnancy. But we appreciate you being here, and we will talk again. But for now, this is Healthier Ever After, and